Research shows that atrial fibrillation is the most common arrhythmia known worldwide. And an arrhythmia is classed as an issue with the heart's rhythm and impulses. So specifically, an atrial fibrillation is when the atria, or that top chamber of the heart, the electrical impulses aren't firing as they should, which leads to flow-on problems down to our ventricles, and then as the blood leaves the heart, further issues down the track. So some key risk factors for developing atrial fibrillation include having sleep apnea, obesity, high levels of cholesterol. We also know there are issues if a person has been diagnosed with type 2 diabetes. So these are some top risk factors when looking at whether or not a person may develop atrial fibrillation. Another one is age. Research is showing that those over the age of 55 are more likely to develop atrial fibrillation, particularly if there are those other risk factors involved. Now, we know that exercise is super important for all populations. If we look at atrial fibrillation specifically, it is absolutely encouraged that exercise commence. And that is because exercise can actually help to reduce the risk of developing atrial fibrillation, and it can help to reduce the long-term outcome for atrial fibrillation. We understand that exercise can help to reduce the risk of stroke developing. It can also help to lower the cholesterol and blood pressure levels, and these have really positive flow-on effects into later years. So if we think about how much exercise we should be doing, research is showing that those with atrial fibrillation should exercise between 3 to 5 times per week, with a real focus on cardiovascular fitness. And in total, across the week, research shows that above 210 minutes a week, you're going to see the best benefits. So if you're not sure on how to start, talk to your cardiologist. You might be screened first before you are given the all clear to exercise. And from there, engage the help of an exercise physiologist, because they will understand your condition and understand the contradictions to exercise and things to look out for. So you can be in really safe hands as you begin your exercise